Dr. Ray. Thank you so
Hi.
much for meeting with me.
Sure, Pamela.
My name is Pamela Brewer, and I am a pre-dental student. And I would like to ask you some questions.
Good. Perfect.
All right, let's get started.
All right.
So, could you tell me a little bit about what you find most interesting about periodontics and what makes you excited to come into work?
Okay, that's a good question. The reason that I went into periodontics to begin with was because it was a science-based practice. Much more so, in my opinion, than, say, restorative dentistry. Restorative, to me, was much more artistic. And since I always was drawn to sciences, that's what I liked about periodontics to begin with. And the nice thing about periodontics is that the science keeps evolving. There are things now that I have available to me to use, like the plasma-rich and growth factors. You've been observing my surgeries, you've seen me use things. And so the interesting part to me in doing periodontics is the ability to help harness the body's own natural healing dynamic and just amplify that and assist it, because that's really what you do when you do surgery. You're just assisting the body do what it naturally wants to do. And that's what I like, and that's what gets me excited about coming into work, is the fact that I get to do what I'm really, really good at, and people appreciate that. And
You're an artist as well.
It makes you feel good about it. So, and I love my patients. I love my team. And so it makes it easy to come and spend more time. I spend more time here almost than I do at home. So, you want to do something in life that you enjoy because of that. Spend a lot of time doing it.
That's awesome. Thank you. What do you think is the most challenging aspect of your job in periodontics?
There are two things. Managing the team. Okay, so just interfacing with a bunch of different personalities on a day-to-day basis, trying to find ways to educate and motivate them to perform at their highest peak performance. You're an employer when you're a physician or a dentist. You employ people, and so just being an employer is in and of itself a challenge. Now, in the actual practice of periodontics, the thing that I find most challenging is actually the physicality of it. After 27 years as a surgeon, it takes a toll on your body to come in and do really fine motor skill work hour after hour after hour. So sometimes it's just a fatigue because you're not only physically challenged when you're working, but you're mentally challenged. You're having to think and perform physically, and that, to me, it's hard. It's a hard thing to do day in and day out.
And is there anything you do to kind of help yourself with those physical demands?
Right. Yeah, if there was any advice that I could give someone your age, it would be to treat your body like you are an athlete if you're going to be a dentist. Because you are. It's an athletic, physical profession.
And you would never think that. You would never ever think that.
No.
Okay.
But there's so much disability in dentistry because people don't take that seriously. I've actually practiced Pilates for the last 15 years because I find that the practice of Pilates is all about the core and lengthening and strengthening. And I find anytime I back away from my practice, I pay a price. And there are things in your life that happen that you can't control for. I've been in car accidents, and as a result of car accidents, you take those blows, they just never kind of go away. You always carry them with you even years later. So it's something that you have to kind of guard and protect against. And so choosing some type of strengthening, don't be a runner and tear up your knees is my advice. If you want to be a really, really healthy dentist, choose something like yoga, Pilates, or any type of core strength training, and that'll help you with your posture and also with your back.
Okay. So that's really great advice. Like I said, you would never think that happens.
Right, it does.
And going back to the field of dentistry, what do you think would be one thing you would change if you could?
I would make the handpieces quiet. So we don't all end up deaf.
Okay.
And the patients, that's probably the thing that patients hate the most is the noise
Exactly.
of dentistry, and I understand that.
The drills, it gets them nervous.
Yeah, it gets them
I
nervous.
can see that.
So I think there are innovations just in the instrumentation that we use that'd be really nice to see. If I could change that for the patients, I would. Making topical anesthetics that could act as profoundly as our injectables. I mean, so all you would have to do would be to swab on something instead of having to, quote unquote, stick the patient, because those are the things they have anxiety about. And, I think we might get there.
In the
but
future of
in the future of
dentistry,
dentistry, you never know.
Yeah.
So,
I'm sure that they have to come up with something, right?
well, they haven't yet.
Hopefully.
Dentistry's been around a long time, but we'll see. I think definitely innovations occur faster nowadays. It's just a matter of, can you get them to market, and can you make them accepted by enough people that they become viable options in the marketplace. But the marketplace is worldwide now, and with the internet, people are able to get the message out faster and to disseminate information faster, so more people are aware more quickly.
Mm-hmm. And I know you said you had a very strong scientific education, and that's what you liked the most.
Mhm.
So if you weren't doing dentistry right now, what do you think you would be doing?
One of two fields, either ophthalmology
Okay.
or forensic science.
Okay.
Mhm.
I can see you doing that.
Yeah, I actually worked for a forensic dentist when I was in dental
Oh.
school, so I have a background in forensics just from a standpoint of a job.
Mm-hmm.
I've never particularly pursued that on the outside, but a lot of dentists do. A lot of dentists have that as a hobby, where they'll go in and take forensic continuing education and actually work as forensic dentists on the side. So it's fascinating. It's fascinating
Mhm.
work. So it's something I always liked.
And do you think if you could go back and do everything all over again, do you think you would still choose periodontics or dentistry in general?
I don't know. It's hard to say, if you could go back and do things over again, because you can't.
Right.
The one thing that I will say is I've never regretted my choice. So would it be interesting to have another opportunity to do something differently scientific? No doubt. I mean, but it's very difficult. It's the rigors. You'd have to go to medical school. You'd have to do all of those things over, and to have those kind of parallel careers, you just can't do it.
Right.
So, I think that had I chosen those fields instead of dentistry, would my life be different? Yep, it would be different. But the one thing that I see being involved, having family members in medicine, is I'm happy now that I'm in dentistry rather than medicine, because the changes that I see medicine going are much less appealing
Mhm.
than the changes that I see in dentistry
Okay.
from a career standpoint.
And how do you manage your work life and your family life?
Well, you just have to be able to turn it off. You do what you call siloing things. So you put things into a silo, and you try to leave it there. So when you leave the office, you not only
Like a switch.
you kind of switch it off, and it's hard to do. Much more difficult than you would think, particularly when you're the business owner of the practice, because you always have other things that you have to tend to. But you just have to turn it off and then make the next thing, your attention. And it's likewise when you're at work. I don't really I try not to take my home life to work. So I try not to deal with as many things that are the house things at work. I try to give work my attention. It's one of the decisions that drove me personally to make the decision not to have children. I didn't think I could do it all. I just knew myself, I knew my personality, and I just felt like I could not be the level of periodontist I wanted to be and be a mother. So I chose, and I don't regret the choice, but I do think that if I had become a mother, I probably would have given up practice. And it just would have been my personal choice. It's not, I don't judge other people and their choices and, you know, them trying or wanting to do it all. And I think a lot of women do walk a good balance, being a mother and a professional. Some are able to be their professional self full-time, and other women make the choice to work for other people so they don't have to own a practice and be the primary person in charge so that they can practice a limited time. Doesn't make them less, and they've actually done studies now looking at that, because the people were asking a lot of questions about that. You know, are women who practice part-time worse dentists than people who practice full-time, male or female? And the answer actually is no, they're not. They can be quite highly skilled and quite gifted.
Right. So I think your practice is your baby, right? Your practice
in a lot
is
of
your
ways, yeah, in
child.
a lot of ways it is your baby. I mean, you have to give it that kind of time and attention, just as if it was a baby.
Right.
And sometimes the people who work for you act like babies. I mean, you know, but people always say, you never had children. I said, I didn't have to. I have employees.
Right.
Yeah.
Perfect.
Yeah.
And can you tell us a little bit, well, can you tell me a little bit about your journey in dental school?
Well, I worked to put myself through school. You know, I had a very wonderful childhood and great upbringing with super parents, but we weren't wealthy. And so fortunately, my mother worked for an orthodontist, and so I got exposed to dentistry early, and that helped kind of guide me into dentistry. Not exactly straight. I didn't know from the time I was young that I wanted to be a dentist, but I kind of found dentistry because I had to work. And it was the only job I knew how to do, was to be a dental assistant. So I assisted starting in high school, and then it was how I funded my education in college. And that, you know, then helped me transition into dental school. And, you know, dental school was great for me. I loved every minute of it. I loved the challenge, and I loved learning. And by the time I was in dental school, I kind of had abandoned working in dentistry during the summers, and that's when I started getting into my sciences. So I worked for the forensic dentist, and I did that really 3 summers.
This was while you were in dental school?
Mm-hmm.
Okay.
While I was in dental school. And then I also worked for cellular and structural biology, doing some basic science research as well. So when you're in dental school, you can actually go to work for the university part-time. In the summers, they usually have positions for the students. And if you're lucky enough to get one of those, then then it was nice. It was really nice because I got to learn while, you know, earning some money. And some people work full-time. I didn't find that I could, again, you know, I could not perform academically and have a night job. And it's impossible to have a day job in dental school. You're just at school from 8 to 5. So you can't work during the day. You have to work at night if you work, or on the weekends. And my academic standing, I really wanted to keep it high. So I just, you know, between what I could earn in the summer, what I could qualify in, you know, any type of scholarships or grants, I applied for those, and then I just borrowed money like a lot of people do. You know, the fortunate thing was it wasn't as expensive when I went to school.
That's what I was going to ask.
It was a lot more.
What is one of the differences?
Yeah, it's huge.
From when you applied?
No, it's huge. The debt that students are finding themselves in is pretty scary. You know, how in debt they're coming out, which I think is driving a lot of employment decisions when you come out. You know, very few people are able to come out of school and really qualify for the type of loans to go out and set up single practices, which was kind of what we all grew up knowing. And that's why you see a lot more group practices, or you see corporate dentistry coming in and scooping up a lot of those young people, because they just have such debt service that they have to try to service until they can get their debt paid off. They're kind of in an indebted servitude to people, and it's unfortunate, but it is what happens.
So, what would be some advice you would give a pre-dental student before even going into dentistry?
Spend time in a dental office.
Okay.
I think it's very important for people to really know what they're getting into. It was really quite surprising to me when I got into dental school and I found out how few of those students that were my classmates really had spent any more time in the dental office than getting their own teeth cleaned. They have no idea really what it was about. And I think the more time that you can spend in dentistry, the better off you're going to be, the better student you're going to be, the better student you are, the more you're going to learn, the more inquisitive you're going to be, and therefore the better doctor you'll turn out to be.
Okay, that's perfect. Thank
Yeah.
you. Well, that's it for my questions.
Well,
thank you so much for your
Thank
time.
you. Thank you for spending time in the practice. You're welcome all the time.
All right, thank you.
Okay.